Hi, I am Dr. Vidya Tikku, endocrinologist at Park Endocrinology, Hyderabad. So today I will be discussing about PCOD or PCOS, that is polycystic ovarian disorder or polycystic ovarian syndrome. So who is at risk of developing this problem? As I told, the symptoms are irregular periods, having hair growth over your facial area, thick hair growth, beard-like hair growth over your facial area. And on ultrasound there can be cysts, we can see it on ultrasound. So if these are there, 2 out of these are there, we can say that you have PCOD. So why is it increasing? Now again, you would have heard nowadays there are so many girls who have PCOD, and previously it was not there. In fact, the prevalence of PCOD has been reported to be as high as 20% in Indian girls. 20% means 2 out of every 10 females are going to have PCOD. It's a very huge number. This is especially more common in cities. So what happens? Why is it more? So one thing is that genetic factors are there. So if you have a family history, if your mother had PCOD, there is increased risk that you might also have the same problem. But other than that, so this is something which is not in your hands. But what is in your hands is basically to maintain an ideal body weight. So the other reason basically for PCOD is if your weight is very high. So what happens is when the weight is very high, there is this thing called insulin resistance, that is your body makes one hormone called insulin, but that insulin cannot act. So this insulin acts at various places in the body. One, it acts on all the cells and causes the absorption of glucose into the cell. So when it is not working, the glucose doesn't enter the cell and it remains elevated in the blood itself. Hence the blood sugars go up. Second is the insulin has action on ovary also. So when the insulin cannot act on ovary, there are multiple small follicles that develop inside the ovary, and there is increased male hormone, that is testosterone, inside the female ovary, and one follicle doesn't rupture during ovulation, so that can lead to infertility as well. So when we lose weight or when we come to our ideal BMI, that is body mass, that is your weight as compared to your height, when we come to that, this insulin resistance comes down, and all the symptoms of PCOD, that is your irregular periods or your hair growth or your infertility even, can reduce. So if you are infertile and overweight or obese and have PCOD, and once you come to your ideal BMI, your chances of conception also increase. So it is extremely important to maintain an ideal BMI. So what is an ideal BMI and what is a BMI? How can you calculate it? So BMI, this term was made basically to compensate for height. Suppose there is a 5 feet tall girl and there is another girl who is 5'7". Both of them have weight of say 65 kgs. Now the 65 kg is very high for someone who is 5 feet, but it is okay for someone who is 5'7". So that is why, to compensate for that, you can yourself calculate your BMI. So your BMI is weight in kgs divided by your height in meter square. So height in meter, which you can calculate, you can just Google and you can convert your height from inches, feet and inches into meters, and then you square that. So this way you can calculate your BMI. So what is normal BMI? Now for Indians, normal BMI means that your BMI should be below 23.5. Now this cutoff is lower than Western population. In Western population, we take a BMI of up to 25 normal, and more than 25 they say they are overweight. For us, more than 23.5 is overweight, more than 25 actually is obesity. Now why this happens is because we have more of fat at the same weight. If we are 60 kg and there is a 60 kg person who is from US, who is basically an American, we will have much more fat as compared to that American, and that fat is especially more over the abdomen in our stomach area. So this fat is basically very dangerous, the fat that is around your stomach area. So that is why we need to maintain a normal BMI to be disease free. So BMI should be below 23.5 to say that you have normal BMI. It is the most important thing, not just for PCOD. It prevents hundreds of other diseases. It can prevent diabetes, it can prevent BP, it can prevent some cancers also. So maintain that. It is extremely important. So how can you know if you are at higher risk of PCOD? I would say if you have a family history, if you are having higher weight that is if you are overweight, if your BMI is more than 23.5, or if you have irregular periods, if you have hair growth that is increasing now over your face or other areas of the body, then you might have PCOS and you need to get checked so that you can prevent any complications that can happen because of PCOD. So for any query related to PCOD, you can contact the given numbers. We are at Park Endocrinology, Hyderabad.